Good morning, everyone. My name's Dr. Silver, and with us today we have a guest, Robin O'Rourke. Robin and I are old friends, and Robin and I go back quite a while. And Robin's going to talk about the history. You have some heart disease, right?
Yes.
When was your first cardiac catheterization?
January of 2007, and I was told at that point that I'd likely need 2 stents.
2 stents. And you opted not to get the stents, right?
Yes, I didn't have the stents. They did do a catheterization, but they did not put the stents in. So.
And then you came to the office a little while ago, and you had some chest pain, and there was a chest tightness. It was down your arm. You were short of breath.
Yes.
You had spoken to your attorney on the phone about some case, right?
Yes, that happened actually the day prior. I'd spoken to my attorney and received a email. I have a bad legal case in a different state, and that particular situation I remember very distinctly. It made me break out into a very severe sweat to the point where, even though it was about 65 degrees in my home, I actually had to take my shirt off because I was just drenched in sweat.
And you came to the office, and
Yes.
the first thing I told you is, go back to Scottsdale Healthcare, go into the cath lab, and get an angioplasty.
Yes, and
And
unfortunately
Robin
I
just
wanted nothing.
he wanted nothing to do with it.
Nothing to do with
And
that.
we
I
checked
remember my first one.
a blood test, a CPK blood test, MB band from the heart, and it was positive.
Yes.
And I called you up that night,
Yes, you did call me up that night.
and I told you to go to the hospital,
Yes.
that you were having a coronary.
Yes.
And he told me he didn't want to. So we started doing some integrative alternative therapies. I'm involved with an FDA study, an investigational research board study for ozone. And ozone gives the body oxygen. And we gave Robin some oxygen, and we gave Robin some chelations of heavy metal detox to get the metals out of his body. And
We did quite a bit of that. We did 2 sessions a day, as I recall, of the ozone for the first couple of days. Then we did another one, and then we did chelation therapy.
and your
And then
chest,
we had a surprise there too, because we found that we had some metals, some concentrations of different metals in the blood as a result of that too.
and your last nuclear stress test, believe it or not, was normal. So it was normal, even though we know he's got blockages, but we normalized it.
Yes.
So tell us about your activity. You just came back from Panama, and you were in
Yes,
an international race, and
Well,
Robin's a biker.
Yeah. Yeah, I've been a cyclist since about age 15 when I was on a professional cycling team in Latin America, and I've been on and off on the bicycle since then.
And your heart rate goes how high?
Into the low 210s, 211, 212. I'm a sprinter, and it's very common for sprinters to run heart rates pretty high. But I just got back. I saw Dr. Silver. When was this? Back in two months ago?
Yeah.
Back mid-January probably. And I just got back from Panama. I went down there for a bicycle race from. It's called the Ocean to Ocean Bicycle Race. It drew 3,000 riders from all over the world. An Italian fellow won it, but it was a very nice race. Humidity's kind of tough down there, but about 3,000 riders, a little over 50 miles.
And your heart function, your ejection fraction was normal, and you had a normal myocardial perfusion imaging study.
Yes.
And would you say your chest pain is gone?
Yes, I scared the nurse during this study because I told her she wanted to stop the test when my heart rate was going into the 170s. I said, no, we need to run it a little bit higher. I have not had any. I have really not had any pain whatsoever.
So would you suggest ozone therapy?
Absolutely.
And heavy metal detox and chelation and vitamins and hormones?
Absolutely. That's the other thing that we did. We did vitamin C, concentrated vitamin C. But when I walked into Dr. Silver's office, I had a hard time with my posture. I was bending a certain way. I was kind of cocking my left shoulder forward and bending. I remember distinctly not being able to walk upright very well. And I knew something was wrong, particularly on the left side of my upper arm.
Yeah, he had chest pain. It was going down his left arm, and he broke out in a sweat. And I just think I do not treat all my patients like this. Robin just wouldn't go to the hospital,
Yeah.
and I'm not suggesting not going to the hospital. And obviously, if the pain comes back,
Yes.
but we're going to continue with the ozone therapy under the FDA study. We're going to continue with heavy metal detox. We never told Robin that this would work.
No.
We never gave any promises.
No, there's
but
never a promise whatsoever. I've had to kind of very slowly get back into the exercise program, but it's getting there. I have to lose some weight still, but I'm very thankful because Alan, Dr. Silver's assistant, was very, very helpful and made it very comfortable for me. And Dr. Silver's guidance, I'm a true believer in this. So.
Thank you. Appreciate
Gotcha.
it. And thank you, everyone, for listening. Sound all right?